Welcome to this lecture series for health professionals focusing on Ayurveda in clinical praxis. The first topic in this series that we will cover is modern medicine discovers Ayurvedic principles. But let me first introduce myself. I'm a cardiologist from Austria. I worked in a big state hospital for 12 years, doing invasive cardiology and being head of intensive care department. But about 30 years ago, I shifted my attention to preventive medicine and lifestyle medicine and discovered Ayurveda to be the champion of this. So ever since I'm focusing on this, and today I'm a chairman of the Maharishi College of Perfect Health International and also chairman of the International Maharishi Ayurveda Foundation for Health Professionals. So let's jump into today's topic. Modern medicine discovers Ayurveda. Why is this important? It sounds a little bit abstract, but Ayurveda is still a kind of unrecognized or niche system in our today's Western world. And therefore it would be extremely helpful if modern medicine would confirm these age-old, thousands of years old Ayurvedic principles, even if they may sound quite strange. To me it sounded strange even some years ago, but it's quite a revelation when we hear these kind of principles have a real scientific basis and they do work. So let's start with the first topic. This is about the whole area of toxins and waste and the need to purify the body, not only in Ayurveda, but in many alternative systems. There is this detox program and washing out toxins and so forth. And modern medicine didn't really recognize the need for this because we already have the liver that metabolize toxins and eliminate them through the kidneys and stools and so forth. And this is anyway a well-working system, no need to do any extra detox or wash-out programs. But this has a little bit changed in the last few years. Now modern medicine talks about cellular waste, for example. Cellular waste are end products of metabolism in the cell, but also it comes from damaged proteins or from damaged organelles such as mitochondria. So this system of waste or toxins, this is there. Whereas when I look now at on the right side, I'm focusing on the Ayurveda terminology. There we have the term, for example, ama. Ama means undigested food. A is always the negation of what is following. A means not, and ma means food. So not, we can say digested food. It refers not only to the digestive tract, but also to undigested food on the cellular level, on the tissue level. So there is already a similarity of terminology. But modern medicine has now focused a little bit more on a process called autophagy, which is a natural system of the body that is there to remove and even recycles these waste products, these organelles or damaged proteins and so forth. And there was even a Nobel Prize awarded for the discovery of autophagy in 2016. It was the Nobel Prize in Physiology. And this was given to a Japanese scientist, Yoshinori Oshumi. And whereas in Ayurveda, since time immemorial, we know the expression ama pachana. Ama we just learned, and pachana means to digest. So ama pachana means the digestion of toxins, of waste. And autophagy, this is a Greek word. This means basically the same. Auto means automatic, and phagy means to eat, to devour, to digest. So actually autophagy and amapachana is the same word. If like you would look it up in a dictionary, one is a Sanskrit word, one is a Greek word. So this is quite a striking kind of match in Ayurvedic principles and modern medicine. And now it goes on that modern medicine now acknowledge that if the autophagy is impaired, this may lead to an accumulation of waste in the body that is even associated with kind of lot of disorders and diseases such as aging, especially neurodegenerative disorders, chronic inflammation, and even metabolic disease. And also in Ayurveda, ama is considered one of the main causes for a lot of problems that impairs the function of the body, and these toxins accumulate in various tissues. So this is quite striking. And modern medicine is now even focusing, especially the pharmaceutical industry, on so-called autophagy activator drugs, because that can help in situations where waste products have been accumulated in the physiology. Whereas in Ayurveda, we use the system of amapachana through herbs. So this, we can say amapachana herbs are now called autophagy activator herbs. But we also use the daily routine that can stimulate autophagy or amapachana. And so a special way of taking the food and special way of drinking special fluids and so forth. So there is also quite a similarity, and that altogether means that it's not so strange anymore to talk about the need for doing some purification procedures on a regular basis to detoxify and so forth. So this is very interesting, I find. Now let's go to the next area which I wanted to show you today, and that is about the gut microbiome. As you know, this is like a big topic in modern medicine, and there's hardly any disease anymore that hasn't been linked to the gut microbiome. Whereas in Ayurveda, there are this, if you don't know anything about Ayurveda, there are these three main principles of Vata, Pitta, and Kapha. Vata is transportation system, Pitta transformation system, and Kapha stabilization system. And the main seat of Vata is Apana Vata. This is a Sanskrit word. It means downward movement of Vata, and the main seat of Apana Vata is located in the large intestine. And Ayurveda says that most of the diseases, almost 80% of all diseases, have their source in Apana Vata, which is very similar to the microbiome research. You know, it was maybe even a few years ago, 10, 15 years ago, when you would say most of the diseases have their source or are kind of associated with a disturbed function in the gut, no one would have believed you. Today, I just show you a few diseases linked to microbiome, like overweight, MS, ulcerative colitis, Crohn's disease, gastritis, irritable bowel syndrome, neurodermatitis, immune system problems, allergies, diabetes, cancer, anxiety, depression, just to name a few. And the reason why a microbiome can be disturbed or imbalanced looks like as areas of Ayurvedic medicine, or areas where Ayurvedic medicine is very strong, like diet. One-sided nutrition, for example, is a cause of disturbed microbiome. If you take too much sugar or lack of sufficient fiber. But not only the food itself, but also the way you eat. The eating habits and the table manners have an influence. And the stress has a huge influence on the microbiome. The stress is like an enemy to digestion. Sleep deprivation, physical inactivity, unfavorable daily routine. All this area is the strength of Ayurveda. We have a lot to offer. So this is a great support for Ayurvedic medicine, and in many of these areas, modern medicine is still a little weak in comparison to the precision-tailored medicine of Ayurveda. We mentioned now quite a few times the daily routine, which is called in Ayurveda the dinacharya. There's now also a modern word for this, chronobiology or circadian rhythm. This is also a recent development of modern medicine. It wasn't long ago in 2017 that the Nobel Prize was awarded for the discovery of the circadian rhythm. And it has been found that a chronic misalignment between our lifestyle, it means the daily routine and the rhythm of the inner clock, is associated with an increased risk of diseases. And also, if the circadian rhythm is regular and in tune with nature, that would support good sleep, the daily hormone secretion, and normal oscillations in body temperature. So this is quite interesting to see this focus on the daily routine, and even the time of the day has been discovered to influence the effect of medicines. This is even called chronotherapy, whereas in Ayurveda we know that the same medicine may have different effects at different times. And even the time of the day when the surgery is done has an influence on the success. So very interesting match with Ayurveda. And here you see in the Nobel Prize paper that has been published, you can see on the right side a diagram, a circle showing the different times of the day, how the body works, and different effects of the circadian rhythm. Whereas on the left side, you see the classical Ayurvedic diagram with the different phases of Vata, Pitta, and Kapha throughout the day. And when you look at the detail, you will find quite a striking match between, what happens during Pitta, Kapha, and Vata time, and so forth. We don't go into detail here. It's an area in itself, but it's very interesting. And I discovered when you look the internet about daily routine, you see all these circles that are similar to these Ayurvedic diagrams all over. So this is very interesting. Next, we mentioned already quite a few times the importance of diet, not only on the microbiome, but on the strengths and energy and everything. This is called ahara in Ayurvedic terms. And it's interesting that recently the World Health Organization is stating that an unhealthy diet is one of the major behavioral risk factors for cardiovascular disease and premature death. That's quite something. And from Ayurveda point of view, we know already that a diet can be very specifically tailored to a person's situation. There's the concept of Agni and how to strengthen this. This is the Agni is the digestive fire, the digestive strength. The Ojas, this should be the ideal result of digestion, to full of energy and happiness. And Ama is the opposite, undigested food that gives depression and bad feeling. So this is a match of giving importance to diet. And recently, in 24, in probably the most important scientific journal of the world for medicine, in Nature Medicine, it states to improve health, the only approach that will be broadly effective is a healthy diet. So I think this says enough by itself. And one more example, the Global US Burden of Disease report from 2010 lists the main causes of morbidity and mortality. And they found on the third place is high blood pressure, which was considered one of the biggest killers in the world, causing at least half of all heart attacks in the world. Then smoking, 11%. But highest was poor diet. Quite surprisingly, this is now the number one cause of morbidity and mortality, according to the US Burden of Disease report. The last point I want to share with you today is the Ayurvedic term nasya. This is a treatment through the nostrils. It's a very simple treatment with a little bit, a drop of oil, a medicated oil that you apply into the nostril. And in one of the main textbooks of Ayurveda, in Charak Samhita, it says the nose is the only gateway to the head for medicines to easily spread to the head. even myself believing Ayurveda, this sounded to me like a bold statement. And it's only a few years ago that modern science discovered the so-called brain-node interface. And that gives a lot of support for understanding how nasya works. The cerebrospinal fluid actually drains into the lymphatic vessels of the nasal mucosa and vice versa. And the main route is through the olfactory drainage. That means the olfactory nerve passes through a so-called cribriform platform on the roof of the nasal sinuses into the head, and along with the nerves, the lymphatic vessels are also going through this opening. And it has been found that the nasal microbiome can contribute to the pathogenesis of neuropsychiatric disorders. So it's quite something. And that explains why nasya has benefits as in headache, but also purifies the brain. It strengthens clear thinking and nourishes the brain. So with this, I wanted to close this little lecture on how modern medicine discovers Ayurvedic principles. The other topics will be an integrative approach to hypertension, which I will cover myself, and my colleagues, Dr. Walter Mölk and Dr. Gordana Markovic, will cover the multimodality approach of Ayurveda, the contribution of Ayurveda in the treatment of infertility, how to practice personalized medicine, and the therapeutic effects of aromatherapy. And last, I want to share with you the opportunity to go deeper into this knowledge. There's actually a one-year program at the at the alma mater European University. It's in Slovenia, in the beautiful town of Maribor. This goes in two phases, half year next year from April to November, and then from November to spring 28. And this gives you credit, 55 ECTS, which means European Credit Transfer System. This program is taught in a hybrid format. That means many lectures are online, but 2-3 times a year you come to Maribor for about 9 days to practice together, to learn pulse diagnosis and so forth. And you can learn more about this by going to www.ayurvedatraining.eu. So if you're interested, you can have a look. And with this, I thank you for your attention.